Should you be using heat and ice after surgery? This is a question that a lot of patients ask me, and the answer is maybe. So heat and ice can be really lovely after surgery for helping with some inflammation and some pain. But I have seen some horror stories. I had a patient recently who had a deep flap elsewhere, and a few weeks after surgery, she was using a heating pad on her abdomen, and the corner of the heating pad got loose from the covering and left a huge burn in her breast. She couldn't feel it because her breast was insensate, and so she had a huge burn that was all the way through the skin into the fat. Now, it was a flap, so it was unfortunate, but it wasn't the end of the world. We did some wound care and she healed. But imagine if there was an implant underneath there. We would have had to take the implant out because you can't have an implant exposed to the outside world. So here's what I tell my patients for heat and ice. Try it. Try 10 minutes of heat or ice, whatever you prefer, and either use a heating pad that's wrapped in a towel or take whatever ice, like a bag of peas you're using, and wrap that in a towel. Set a timer for 10 minutes. You're tired after surgery. You're going to fall asleep all the time. The last thing I want you to do is fall asleep with an ice pack or a heating pad on your chest and lead to a skin burn that would have been avoidable if you just put a timer on. So, short answer, it's okay to try heat and ice, in my opinion, but please always ask your surgeon. Wrap whatever you're using in a towel, set a timer for 10 minutes. If you used either and it helped, let me know below.